What is the cure for diabetes? What are the latest steps taken to cure diabetes? Hi everyone, this is AY the Diabetes Doctor. I'm a doctor and specialist on diabetes. I have received a lot of questions over the past few years on what is the cure of diabetes. Increasing number of people living with diabetes are curious because the cost of medication has increased exponentially, the cost of tests has increased, the cost of screening for all the complications of diabetes has increased. With the financial challenges experienced in developing countries, the burden for diabetic patients to manage their diabetes and live a healthy life has increased. So this has increased the curiosity of people living with diabetes on what is the way out. Is there a cure for diabetes? For us to understand if there is a cure for diabetes, we need to understand what is cure. Cure is a condition or a state in which a disease has been totally treated and has no chance of coming back again. So, you are said to be cured of a disease if you have been treated and that disease will never come back again. In diabetes, it means that you have been treated for diabetes and will never have that chance of that diabetes coming back again. So that diabetes does not have that chance to come back again. All right. So the issues here is what are the attempts that have been made to cure diabetes? There are several attempts that have been made. First of all, attempts that have been made to cure type 1 diabetes. If you want to know what type 1 diabetes is, watch my video on what is diabetes. And type 1 diabetes is the immune cells that are supposed to be fighting infection that destroys the pancreas. And the pancreas, as you have seen in the earlier videos, is the organ that has a cell that produces insulin. So these immune cells destroy the pancreas. So attempts have been made by researchers to stop these immune cells from destroying the pancreas. However, there's nothing conclusive on that yet. Secondly, another attempt that has been made is in the lab is producing stem cells that work like the pancreas. So they will be transplanted in a patient with diabetes with the hope that it will produce insulin. But there are questions on the stem cells. How long will this last? Is there any side effect? How long will someone see the benefit of that stem cell? So it is yet to be conclusive also. For type 2 diabetes patients, those who have insulin, but the insulin is not functioning properly and subsequently have insulin deficiency, attempts have been made to also create stem cells in the lab to transplant it for type 2 diabetic patients, especially those who are not producing insulin again, so that that stem cell will act just like the pancreas and produce insulin so that the individual will not need medication or insulin. However, this is yet to be conclusive. So these are attempts that are still on trial but not concluded. So to answer your question, what is the cure for diabetes? There is no cure yet. But the good news here is, especially for patients with type 2 diabetes, there is what we call remission. What is remission? Remission is a state that a diabetes patient attains in which he has good glucose level without medication, only adhering to diet and exercise. So if you have good glucose level for at least 3 months and above without medication, we said you have attained remission. For you to be declared that you have attained remission, you need what we call HbA1c or glycated hemoglobin of less than 6.5%. You will ask, what is glycated hemoglobin? This is a test that is done on diabetic patients to assess their blood glucose level for the period of 3 months. So if you have a result of less than 0.5%, you are declared to have attained remission. If you're on continuous glucose monitoring, which is a system of monitoring the glucose continuously via a patch, as you can see here, which sends signal to a receiver, which could be your phone or a receiver. Every 5 minutes, it measures your blood glucose. So if an average is taken and your blood glucose is less than 7 millimoles per liter, a period of 3 months and above, your time to achieve remission. So who are the candidates for remission? Most of the time, people that easily attain remission are people that still produce insulin, but what they often have is that at the point of action of the insulin, there is a problem. So, but for people that already have severe lack of insulin, it's very difficult for you to have good glucose level only on diet and exercise. So to answer your question, what is the cure for diabetes? There is no cure yet, but there is remission, which can be attained especially by people with type 2 diabetes. If you like this video, kindly subscribe, click on the bell so that you will be notified anytime I do a new video. Thank you.